My training has taught me that if you teach people to fish, you will go much further. And I think this is what the MINT Clinic does, is it allows all the experts to teach people to fish. My name is Carmela Tartaglia. I'm a cognitive neurologist and I work at the UHN Memory Clinic. It's about 2 years that cognitive neurology has come on board to support the primary memory care clinics. I think this model is the way of today and the way of the future. Many of us want to help as many people as possible. Well, the only way to be able to treat somebody is to actually know what they have. So if you don't diagnose somebody properly, you aren't going to get them the targeted therapy that they need. The MINT model will give you a diagnosis at an earlier stage of the disease to the patients so that if there's a therapy that's available, the patient will have access to it. Going to a MINT clinic, they get a great workup and they'll do a full, thorough assessment of the patient. And we worked with the MINT clinics to really create an assessment that would help us arrive at a diagnosis. So the kinds of cognitive tests that they're now giving, the neurological exam that they're doing, is all with the end goal to be able to empower people to be able to give a patient a diagnosis. And so for the patient, they receive a diagnosis in a timely manner. And if the primary memory care physician feels like, well, you know what, this is, out of my scope. It's not there's complex issues here or there's atypical issues, then they can put it together in a consult form, include the neuropsychological testing. We review all that information and then we relay back either more questions or what we feel is going on, or if the patient needs more tests. And so at the end, we hope to be able to arrive at a diagnosis, and then the patient receives that diagnosis in a very timely manner versus waiting. With this increase in population of dementia patients, we really need more and more people to be enabled or empowered to be able to say, yes, this is what you have. In essence, it has to be earlier, because until recently, people weren't even getting a diagnosis because of the distance, because of circumstances in their lives. And so I think that that's the way of the future, is that, we can work with the communities to be able to help patients access therapies faster, access diagnoses faster, without necessarily having to have them come to, this hospital. And that's what cognitive neurology has added to a MINT clinic. That this partnership that we have could actually help the physicians, but most of all, help the patients.